As the nurse, there are things you will need to assess for the patient before, during, and after a seizure. So let's look at those closer. The first thing we need to assess before a patient has a seizure is whether or not the patient is at risk for seizures. Now, we talked about this in the causes lesson about what sorts of things can cause seizures. So if you get a report and you find out that your patient, let's say, had a stroke and now they have a sodium level of 165, there's some definite risk there, right? So then the next thing we're going to assess is medication compliance. We want to make sure they've actually been taking their anti-epileptic drugs. Not having these medications at a therapeutic level can cause breakthrough seizures and even status epilepticus. And then if this patient does have a seizure disorder, they may actually be able to sense that one's coming on because they get an aura. An aura is basically some sort of feeling or a sensation, and sometimes people will actually see things that tell them that they're potentially about to have a seizure. Some people will see squiggly lines like what you see here. I've had somebody say that they taste metal. I've had somebody say that they felt tingly. So it's going to be different for every patient. So just ask your patient, do you get auras with your seizures? And if so, make sure you let me know if you're getting one. That way they can give you kind of a heads up or a warning that they might be having a seizure. Once the patient does begin having a seizure, our number one priority is safety. Okay. So that means protecting their airway and keeping them free from injury. A lot of patients who have seizures will have difficulty breathing, or they could potentially even aspirate during the seizure. Now, we'll talk about nursing interventions specifically in the nursing care lesson. However, part of your assessments during a seizure are to make sure that we prevent or quickly address and treat those complications. We don't want them to bite their tongue, we don't want them to aspirate, and we don't want them to get hurt. We're also going to make note of what time the seizure occurred, when it started, how long it goes on, and then any events that led up to the seizure. Some patients, I've actually seen a patient who was having a bowel movement, and that vagal stimulation caused them to have a seizure. And then, of course, you want to make note of what type of seizure that they are having. All of these things are information that you need to monitor during a seizure, monitor for safety, and make note of the timing and things because you're going to need to document them later. So after a generalized seizure, patients are going to enter what's known as the post-ictal phase or the post-ictal state. Now, this typically doesn't happen with focal seizures, but some of those patients might say they feel a little dizzy or kind of feel weird after. Now, in the post-ictal state or post-ictal phase, patients are going to be very drowsy. They may even take a few minutes to even regain any sort of consciousness. They're not going to remember the seizure or what just happened. They tend to be disoriented and sleepy, and sometimes they get a little agitated because they're confused and they're scared and they don't really know what just happened. And honestly, sometimes this is one of the easiest ways to know whether a patient had a true generalized seizure. If this patient, goes into convulsions and then wakes up and immediately says, "Oh, wow, I had a seizure. That was a bad one," there's a possibility that they could have been faking. Of course, patients don't read textbooks, right? But 99% of the time, patients are going to enter this drowsy, disoriented post-ictal phase for a brief period of time after a generalized seizure. So we want to assess their level of consciousness, and then, of course, continue to keep them safe while they're still a bit disoriented. They do have a risk for injury when they're not really sure what's going on. They could hurt themselves or somebody else. So we want to make sure we focus on safety. So let's recap. Before a patient even has a seizure, we want to assess for risk factors. We want to make sure they're compliant with their medication, and then ask the patient whether or not they experience auras with their seizures so that they can notify you if they're going to have one. And then during the seizure, we're going to focus on assessing their airway and their respiratory status. We're going to make sure we focus on keeping them safe and trying to determine a possible cause. So that is taking note of the timing of when it started and any events leading up to the seizure. And then after, they're going to be in that post-ictal drowsy phase. So we want to make sure that we're assessing for any risks and assessing safety and assessing their level of consciousness. So those are the major assessments for patients before, during, and after seizures. Keep working through this module to learn more about therapeutic management and specific nursing care for these patients. You guys are awesome. Let us know if you have any questions. And as always, happy nursing.